Hi, this is Dr. Ori Quinn here at Ozark Holistic Center. I just want to shoot this quick video because of a really neat kind of case that we had coming in this morning. It's someone we worked with now for just a couple months. They originally came in because of generalized joint pain they were experiencing really throughout their body. They also had a couple other complicating things like endometriosis and a lot of fatigue, tiredness, headaches, those kind of things. And so the doctor they'd seen previous to us actually did run quite a bit of blood work, and they identified a low vitamin D level. Vitamin D is something that we do test in here normally. Your kind of low end range is actually 30, so the range is usually 30 to 100. Anything between 20 and 30 is considered deficient, and anything below 20 is considered insufficient, and they were actually down in the teens is where they were. And so it's one of the lower numbers that I've actually seen here in the office. And so whenever the other doctor identified this, they started giving them vitamin D as a supplement, but even one drop of vitamin D would actually cause them to be really sick, like nauseous, vomiting, throwing up. And so they couldn't figure out how to address that or what was going on. And that's ultimately why they ended up finding us here in this office. And so in her history, it turns out that for quite some time, she had a sensitivity to sunlight. So being out in the sun would sometimes even cause like a rash, but for sure would cause like headaches, tiredness, fatigue, interesting enough, a lot of excessive sneezing. And so that is often sometimes associated with things like autoimmune conditions such as lupus, but the other doctor kind of ruled that out through some of her blood work testing as well. And so we're really just dealing with this sensitivity to sunlight, or sensitivity to vitamin D as a supplement, and then we're also looking at this like generalized joint pain, which the generalized joint pain could actually be explained by the low vitamin D levels. So when you get low enough, you start falling into the categories what are known as rickets, and rickets will create general pains throughout the body, joint pains. And so through the techniques that we do here in the office of muscle testing, applied kinesiology, we're able to actually test and check against that vitamin D and identify, could we give something else to like help in the absorption process and the way the body actually handled the vitamin D supplement. So we're able to identify a couple different herbs to help in that process, reishi being one of those, and there was a couple others. We also identified other sources of vitamin D other than just a straight supplement. So cod liver oil has a small amount of it. Beef liver is another one that actually does have amounts of vitamin D, and so you're able to kind of get certain sources out of the diet directly for the vitamin D. So then we started giving those different things and kind of one step at a time. Because again, before she was even reactive to one drop of vitamin D supplement. So combined with the herbs, we actually didn't have the same reaction of the nausea and those kind of things. And so we're able to get her going on just a couple drops of vitamin D a day. And now we've actually seen over just a couple of months a really great improvement in what she was experiencing. So the generalized joint pain has really gone away. She's not experiencing it throughout the day. She still gets it a little bit if she gets overly tired or if she kind of sleeps wrong, then she'll still get some of those pains, which that's pretty normal for almost anybody. Her light sensitivity has calmed way down. She's now been able to spend long periods of time out in the sun, especially for her job. She's needing to be able to do that without the symptoms and the irritation that came with that. So it's a really kind of neat case. We're still tracking that vitamin D in the blood work, seeing it increase and working towards getting it higher and higher, closer to a number that we actually want it to be at. But now we're being able to increase her vitamin D amounts over time as well. So yeah, I just wanted to kind of show you, talk through that case. Is kind of a unique case, but kind of a fun case that came in and that we've been working on here in the office. Thanks.